Hello, good morning. I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Hello, doctor. Good morning. I am Roger Federer, 44 years old.
Okay, nice to meet you. How can I address you?
You can call me Roger, doctor.
Okay, Mr. Roger, I have got a letter from your GP saying that you had collapsed last week and lost your consciousness. Is it right?
Yes, doctor. Yes.
Okay, I'm going to discuss about your condition and I will take some note, but all the information during your discussion will remain confidential. Is that okay for you?
Yes, doctor. Okay.
Okay, so can you please tell me in your word what has happened to you?
Okay, doctor. Actually, it was around 1 week back. I was actually doing some gardening. It's my hobby. So while doing that gardening, I just suddenly felt that there was some abnormal sensation around in me, specifically in my tummy. Actually, I think so, and I lost my consciousness. Okay, and I hadn't had any sense till I went to the hospital. And when I went to the hospital, I noticed that actually there was quite a time gone. Okay, my daughter actually took me to the emergency, and the whole day actually felt very much confused. And gradually, after around 12 to 13 hours, I gradually started to regain myself completely. So some people told me that this can be a problem of what you say fits, and I'm not sure about it, so I would just like to be confirmed about it, doctor.
I'm sorry to hear that. And can you remember that? Is it the first time, or did you have this type of symptom before?
Actually, I had some dizziness before, actually, doctor, but I haven't lost consciousness, or I think this type of symptoms I didn't have to face before.
Okay, and you said that before the onset of the symptom, you had some abnormal sensation in your tummy. Can you tell me more about that?
Well, actually, doctor, I cannot tell you clearly about that sensation, but I think that there was something abnormal sensation in the tummy, and I think I had some abnormal movements in my lip. Okay, so I think I had those problems, and suddenly I just fell on the floor and lost my consciousness, and that's all, doctor. And I know nothing more about it, and uh, and the next moment when I had my consciousness, I was in the hospital. But my daughter told me that actually it was quite a long time since I had lost my consciousness, and during that time, I think there was some shakiness of my body. She told me. Okay.
Okay, and before the onset of the symptom, what were you doing? You said that you were working at the garden. What type of working you were doing at the garden?
I was just normally walking around in the garden, doctor. I was planning to do some trimming of the trees. Okay, I was just planning about it, and this suddenly came along.
And before the onset, can you remember that? Did you have any racing or pacing of your heart?
No, doctor.
Any headache?
No,
Any weakness at any side of your body?
no, doctor.
Any feeling of nausea or feeling of throwing up?
No, doctor. No, no, sure.
Any hot and flashy symptoms?
No,
And what were the environment at the time? Was it very hot?
no, doctor. Actually, it was quite okay. Not very hot, doctor.
And during the symptom, can you remember anything during what happened during the symptom, or just after falling down, you lost your consciousness?
I just lost my consciousness, and all I know is from my daughter what happened to me.
Okay, and she said that you had some shaky movement of your lips.
Yes.
Did you got any injury during that time?
No, doctor. I haven't noticed any.
Okay. And did anyone tell you that you have lost control of your bowel or your water work?
Yes, doctor. My daughter told me that I had wet my clothes during that episode, and it was very bothering for me.
Did you beat your tongue at that time? Can you remember?
I don't remember. I didn't had any bleeding or anything from my tongue.
Did anyone say that you have changed your color during that time?
Actually, my daughter could notice about it.
Okay, I will ask about your condition during that time with your permission later. Okay.
Yes, yes, no problem.
Okay. And for how long were you unconscious? Can you estimate any?
Doctor, I think I was unconscious for around 10 to 15 minutes, I think.
Okay. And after that, gaining consciousness, could you remember that what happened during that episode or what happened before the episode?
Uh, Doctor, I cannot, I have no memory of it actually, doctor. What happened during that episode? I completely lost my
And
consciousness.
after gaining your consciousness, could you remember your surroundings or could you recognize your surroundings?
Gradually, doctor. At the beginning, I could just recognize my daughter's face. I couldn't at the beginning recognize where I was or anything like that. But gradually, I started to recognize and I started to get my memory back. And as a whole, it was around 8 to 10 hours, I think, to be completely normal. Okay.
Yes, yes, I can understand. And after that, you said that you feel drowsy. That means you feel sleepy.
Confused, drowsy. What can you tell, doctor? I think that's all.
And any other symptom at the time, like any headache, any racing or pacing of your heart, any feeling of hunger, any sweating?
Doctor, but I thought there was some headache, some very mild headache. I cannot be very specific about it.
Any racing or pacing of your heart?
No, no, no.
Any feeling of hunger?
No, doctor, no.
Any excessive sweating?
No.
Okay. And you said that you had some dizzy spell before. Can you tell me more about that?
Well, doctor, actually, it was around 4 to 5 months back. Actually, I had another dizzy episode, and but this was not like that. At the time, I was just doing some job for some. I was just getting up, okay, and I suddenly felt dizzy. So that was a very short time episode, doctor.
Okay, and that happened only once.
Just once, doctor.
Okay, and I am going to ask you a few other questions. That do you have any headache?
No, doctor.
Any changes? Any changes in your vision?
No.
Any reaction even in your body?
No.
How about your appetite?
It's quite well.
Is there any change in your weight? Have you noticed anything?
No.
Any hot or cold weather preferences?
No, doctor. I haven't noticed.
Any chest pain?
No.
Any shortness of breath?
No.
Any cough?
No, doctor.
Any racing or pacing of your heart?
No, doctor.
Any lumps or bumps?
No.
How about your bowel and bowel habit?
Well, doctor, that's another thing I would like to talk about. Very recently, I think around 2 weeks back, I had some loose motion, and I had been on some medication for that. Okay.
Can you tell me the name of the medication?
I think, doctor, that was an antibiotic. I cannot just fully remember the name, doctor.
Okay, that is not a problem. How frequent? How many episodes you had this loose motion?
Yes, doctor. At the beginning, I had just loose motion for, I think, 6 to 8 times per day. And after taking that medication, actually, I'm sorry to say, but actually it didn't improve that much. So rather, I think, doctor, I also noticed some blood in my bowel motions.
And now you have blood in your bowel motion. Yes.
Doctor, I'm sorry to say, but at times I still have some blood.
Okay. When you first noticed it?
I think around 9 days back.
Oh,
2 days before this episode.
okay. And is the blood mass, or is the blood is losing profusely?
Not profusely, doctor. I think, but it's red. It's not black or something like. I can recognize that it's blood, but I think it's mixed. But no, it's not frank blood.
Do you have to?
It's not frank bleeding.
Yes. Do you have to go to toilet at night after after sleeping?
No, doctor.
Okay. And how would your water work?
It's quite well, doctor.
And do you have any weakness at any side of your body?
I don't think weakness, doctor, but I think I sometimes feel I'm feeling a bit tingling numbness in my left hand for the last 7, 8, 9 days. Doctor.
Okay. And any changes in the sensation?
Yes, I think I told doctor some. I think some tingling numbness.
And any changes in sensation, like any hot or cold sensation discrimination?
I couldn't recognize, doctor, but I think that I prefer to take off a blanket at night so that I feel a bit more better.
You said that you had a fever at night.
No fever, doctor, but I think there is sometimes I feel a bit pain, a bit burning pain. So I feel a bit irritated, and I feel better when I take off any blanket or any heavy thing on me. Nothing else. No fever, doctor.
Any joint pain?
No, doctor.
Any stiffness in your neck?
I haven't noticed, doctor.
Okay. Do you have any past medical condition that you would like to share?
No, doctor.
Okay. And do you take
Oh,
any?
sorry. You told about past medical condition. There is nothing significant, doctor. But I had I have high blood pressure, which was diagnosed actually 1 year back, and for this I had been having some what the doctor told me that Ramipril, okay, and I started taking that around 8 months back.
Is your blood pressure under control now?
Yes, but totally under control.
Okay. And is there any changes in the dose of Ramipril recently?
Yeah, yes, doctor. 6 months back, I had some increase in the dose. Then my dose has been completely all right,
Okay.
and my blood pressure is also all right.
And do you take any other medication?
No, doctors. No other medication.
Any over-the-counter drugs?
No.
Any herbal products?
No, doctor.
Do you have any allergy to any medication?
Not that I know of.
Okay. And I am sorry to ask, but do you take any IV drugs or any blood cell medication?
No, doctor.
Okay. Any of your family member have this type of condition?
No.
Any disease that runs in your family?
I don't know of any, doctor.
And any history of heart problem in your family? Do you know any of those?
I don't know.
I ask you a few personal questions.
Yes.
Okay.
Yes.
Do you drink alcohol?
Yes, doctor. I am sorry to say I drink.
Okay. And do you know the social limit?
I know, doctor, but I'm sorry to say that I got divorced 3 months back, and I think since then at times I drink a bit more of wine. Okay, though I know the limit, I sometimes drink more.
I would recommend you to stop drinking totally, because it may be related to your condition, and if you need help, I can refer you to the it's a drinking cessation clinic. And I am again asking that, can you remember that when this happened, did you took any binge drinking that day?
No, not that day. I have been gradually recovering, doctor. I think I have been gradually reducing my alcohol intake. I didn't have
Okay.
any binge drinking recently.
When did you drink last?
I think around 12 days back, 1 or 2 pints, nothing more.
Okay. And before that, you took a lot.
I think for the last 1 month, I have reduced it quite a lot. Okay. For the first 2 months, I drank rather more.
Okay, time up. So I am continuing. And do you smoke cigarette?
No,
That's fine. May I know that what do you do for living?
I'm a writer doctor.
And do you drive?
Yes, doctor.
Okay, I would recommend you stop driving until we are sure that what has happened to you. Is that okay for you?
Okay.
And may I know that what is your concern?
Well, doctor, what's going on with me? I'm not sure. I'm a bit nervous. What can be the cause?
Actually, I need to examine you now, then I could give you the better explanation. And I am thinking that there might be some causes that has caused your symptom, like you are taking those medication called Remipril that can also cause this symptom, and also you had a loose motion that may cause some loss of some salt from our body that can cause this type of symptom. Okay, and also you said that you have some lost blood, so that also be a cause, but it is less likely that sometimes a low blood can cause unconsciousness. And again, that you as your symptoms suggest that you probably had some type of seizure activity, but we need to take more detailed history from the observer, that is your daughter.
Okay. And so, do you need admission, doctor?
For your bloody stool, I think I need to examine you, and I think that you may need admission for that.
So, doctor, is it curable, doctor? What will happen to me if it's what you are saying?
We
What will,
okay, we'll actually run some blood test, some scanning test, and after that we can tell you that what has happened to you. I am sorry that I am not quite sure that what has happened to you at this point.
okay, doctor. That's all right. Thank you, doctor.
Thank
Okay.
you.
So what are your DDs here, differentials here?
Okay, my differential here, this is probably a case of epilepsy that can be secondary to disease electrolytemia, as this patient have a history of diarrhea for last 7 days, and also this can be a case of postural hypotension, that cardiac syncope are most likely due to postural hypotension due to his drug taking, that is Remipril. And you will also consider another thing, that this can be a case of delirium tremens, as he was taking a beans. He was taking beans. He was a beans drinker.
Okay. 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 Well, may I ask you something? That I gave some clues. I think you could have asked some more questions. That I told you that I had some loose motion, and I had been taking some antibiotics. First of all, the loose motion, the frequency, that's you have spotted very well. That's okay. These electrolyte imbalance can be a cause due to the loose motion. But I told you that there has been some changes in my sensation. There has been some blood in my stool. Well, I think you could have asked about any yellowish discoloration of my body and some pallor. Okay, it
Yes,
can be TTP.
yes,
Okay,
yes,
it could have been TTP. Again, uh, there you I told you that I have been taking some antibiotics. So some antibiotics can actually lower the seizure threshold, like ciprofloxacin. Okay, so I think that you could have also brought it under DD. So it's not mandatory, but you could have brought it under DD. That whether you have had those drugs regularly, or have you taken more drugs, more antibiotics, beyond the prescription level. Okay, I think you could have asked that. And okay, and these are the DDs you think. And what do you think that how would you manage it? Manage the patient?
Okay, well, first I will go for the investigations, that is baseline investigations, complete blood count to see anemia and white blood cell count level, then inflammatory markers, then a liver function test, renal function test, including serum electrolytes and serum creatinine level, and urine for routine examination. After that, I will go for the ECG, echocardiogram, and may also need for Holter monitoring for this patient. And after the test results come, I will go for the next management step. And if it is a case of thrombotic thrombocytopenic purpura, then I will go for his admission and maintenance of his fluid and electrolytes level. And also, I will take consultation from the gastroenterologist.
Okay, if in TTP actually it's actually a kind of hematological emergency, and if it's TTP, I think its plasma exchange is important. Okay, so that's important. No problem. Okay, and may I ask you that did you ask about swimming? As far as I'm concerned, you didn't ask about swimming. So I think swimming should have also been asked in case of this type of patients, loss of consciousness. Driving, swimming. Does he go to cooking or exposure to fire more often? About his home condition,
I should have asked that.
okay. Okay, so these things should have been addressed. And other things, just one thing, in the family history and also in the personal history, I think you could have asked about any clotting problems. Okay, this could have also been asked, I think. And yeah. And otherwise, I think it were more or less okay for me. And I think there are two other participants as well. I think the floor should be open for them whether they give any opinion or not.
Okay, our mentor, Dr. Raza. He wasn't present. He wasn't present all over the conversation, so he may not today.
No, I just
Okay.
According to the scenario, Dr. Raza, do you consider? Can you tell me the list of the consideration that you would consider as the differential or as the causes you would think?
based on the thrombocytopenic purpura TTP, and first thing is like for investigation, you mentioned complete blood count, in that anemia and thrombocytopenia, and what else you will see in the peripheral smear. That is very important. That is
peripheral smear, that is cystocyte, I think.
Megakaryocytes.
Megakaryocytes.
Yeah, megakaryocytes is the diagnostic one, and and then because one megakaryocytes, and one more thing, bleeding coagulation parameters like BTCT and PTANR, and then apart from this, would you like to do? Would you like to consider for other things like?
Yes, I will Combs test and Adam TS3 level.
Yes,
that's very important. Adam TS3 is the most important.
Okay. Yeah, that is a diagnostic one. And 1 Willebrand factors, 1 Willebrand factor. And then what is the specific test would you like to do in this patient? If patient is having problem with this bleeding, is there any problem with the aggregation or the plug formation? Which specific test would you like to do? Is there any specific name test would you like to do? And this, even though it's not present with this condition, but would you like to do with that? Because if platelet count is normal and Adam TS is positive, TS is present and megakaryocyte is present, would you like to do any specific test? Starts with R.
I cannot remember.
Okay, ristostatin. That is the test
where ristostatin.
Yeah.
Okay.
Ristostatin.
Yeah.
I think PFA function test.
1 Willebrand factor. Glanzmann's thrombocythemia and Bernard-Solier thrombocythemia. In these conditions where platelet count is normal, but adaptive adaptive 3 is negative. But in these patients, quantity is normal, but qualitative defect.
Okay, can you repeat it? I couldn't hear you. Actually, your voice is muffling.
Yeah. Hello?
Yes.
No. If in case the specific in case the platelet count is normal and BTCT everything normal, and if we found peripheral smear is showing megakaryocyte and one more that Adamtes, what is the pronunciation is that Adamtes is 3 is positive. In that condition, you would like to differentiate the quantitative defect versus qualitative defect. Okay, in that patients, we should do this ristostatin test, which differentiates between these two. If it is positive, then it is due to Glanzmann's thrombocythemia, I guess, rather than Bernard-Solier's. Okay. If in this in TTP, one more thing is drug of choice is first is prednisolone. If not working, then only you'll have to go for this transfusion and all. Okay, but the treatment of choice is prednisolone first. And apart from this TTP, in thrombocytopenia purpura, only few conditions which have this urgent transfusion or the plasmapheresis has to be done, especially with CNS features and active bleeding and the CNS features. Only few indications were present for this plasmapheresis or transfusion has to be done. Otherwise, that treatment of choice is steroid. Is there anything else for the treatment purpose in TTP?
I have no idea.
I think that's all for TTP. I don't think anything more for that.
Okay, how will you differentiate between HUS versus TTP? Because this guy had diarrhea followed by hematuria, I think blood in the stool. And is there any hematuria?
No, he told that his water work is fine.
Okay, suppose if if renal function test with electrolytes has been deranged, if the creatinine is high, your urea is also high, would you like to consider still as a TTP rather than HUS?
Sorry?
No, if this patient is having derangement in the renal function test.
Yes.
Okay, and he is having same kind of features like he had diarrhea in the past and now presented with this low platelet count and some bleeding manifestations, including blood in the stool, blood in the urine. And but still, would you like to keep this TTP as a first choice rather than HUS?
I think TTP could have been brought here as well because I don't think, is it always frank hematuria present in TTP? I might find that in tests as well.
I think CNS involvement is more common in TTP.
Yeah, CNS involvement is more common in TTP rather than here is G8 is more involved in this HUS. And HUS is more common in the young people and TTP is more common in the elderly people, I guess.
So he is actually a rich person, so I think it can be both. But I am not sure that always whether frank blood is present in the water work in case of TTP. I am not sure about that. I don't think so. Sometimes I can also find blood in the urine microscopic examination, I guess. Might not be frank blood.
Mm-hmm.
Hello.
Yeah.
Yeah. And any other thing? Hello. Any other thing would you like to discuss?
We can think like angiodysplasia with valvular lesions like itis stenosis might cause the bleeding per rectum. and but it will cause anemia rather than thrombocytopenia. So we don't have evidence for that. And then CNS symptoms with the pancytopenia features like Whipple's disease also will cause that. Cognitive impairment with the steatorrhea features with the pancytopenia features. Whipple's disease also will cause this, and even celiac disease also will have this kind of features. Apart from this too, and even pancytopenia is a feature of subacute congenital vitamin B12 deficiency as well. But I don't think so. They will have. They may have bleeding per rectum in case if it is associated with the Crohn's disease.
Yes. But I think seizure is a bit uncommon in Crohn's. I'm sure.
No. Vitamin B12 deficiency will have these seizures and even cerebellum features. Some kind of psychosis as well.
Okay.
Vitamin B12.
Okay.
That's called subacute complete degeneration with this issue. They might have this,
Okay.
And if alcoholic patients, they may have this seizures, but I don't think so. They have this bleeding per rectum. Bleeding per rectum may be there secondary to this varices, alcohol liver disease patients. Seizures also may be there secondary to alcohol dependent or alcohol withdrawal syndrome.
Okay.
That is very rare because you mentioned that he is binge drinking alcohol, right?
Yes. No, actually, been drinking for the first 1 or 2 months, but now he has stopped that drinking.
Oh, 1 or 2 months only. Okay.
Yeah.
Okay.
So Manilal, are you present there?
Yep.
Do you think that anything more should be discussed in this case?
No, I couldn't catch this case. That is my failure. So I am a little bit
No.
upset.
Not failure, man. You're very good present, man. You did well, man.
No. Actually, what happened, Manilal? You gave the same case to